Hello, hi, a pleasant good day to you. So today this video will be about programmatic competencies, specifically outcome number one. So almost every program must have a list of outcomes that they need to accomplish. So the governing organization or the accrediting organization like ASEN or NLN will look at these outcomes to measure if the program is meeting those outcomes. So in turn, what the nursing program in this case will do is give assignments based on those outcomes and even ask students give examples of how they're meeting these outcomes. So this may come in the form of an assessment. All right. So in this particular case, I'll be discussing 5 outcomes. This video is for outcome number one. All right. So here is outcome number one. A DNP program must integrate and apply appropriate nursing and science-based theories to evaluate and analyze health and healthcare phenomenon and develop and implement innovative practice approaches. That's outcome number one. Now, the question below help you to answer outcome number one to see if you've met the outcome. And here are a couple of questions that you can answer that will show that you have met the outcome. So question number one, in what way have you integrated and applied nursing and science-based theory in your coursework and practice during your DNP course of study? That's one. Two, how will you apply what you have learned to your DPI project? And three, cite specific evidence from your coursework and practice immersion hours in your response. All right. So by answering those 3 questions, it will show that you've met outcome number one. So for this video purposes, what I've done is split the question up and give you an example of how you could answer these questions. So for question number one, in what ways have you integrated and applied nursing science-based theories in your coursework and practice during your DNP course of study? Here's how you could answer this. During my coursework, I've studied the health belief model, a well-established nursing theory. This theory proposed that an individual's health-related behaviors are influenced by their perceived susceptibility to a health issue, the perceived severity of that issue, the perceived benefit of taking a specific action, and the perceived barrier to taking that action. As a part of my coursework, I conducted literature review focusing on improving childhood vaccination rate in an underserved community. I integrated the health belief model into my project by using it as a theoretical framework to understand the community's hesitance towards vaccination. Through surveys and interviews, I've collected data to assess the community's perception of susceptibility, severity, benefits, and barrier related to childhood vaccination. This data was then analyzed to help create the framework of my project. In my practice immersion hours, I applied the insight gained from this coursework project and developed a vaccination outreach program for community. By addressing the community's specific concern, I tailor the program to improve vaccination rate. I collaborate with local healthcare providers and organize educational sessions to convey the benefits of vaccination and address the perceived barrier identified in the search. Now, I know you may say, especially for that last one, I haven't developed my project as yet, so I can't say that I implement anything. But for your practice immersion hours, did you meet with your mentor? Did you attend meeting as it relates to your DPI project? Were those meetings tailored to your project that you're going to come up with? So you can put that in that section. So here's a second question. How will you apply what you have learned to your DIP project? For my DIP project, I intend to build upon my understanding of nursing and nursing-based theories and the data available from national bases. I will ensure that the new care delivery model is informed by the latest evidence and nursing theories, aligned with my journey to improve vaccination rates. The project will be founded on the best practice drawn from nursing databases and will be guided by data and guidelines from national sources such as the CDC, CMS, ADA, and AHA. This synthesis of knowledge will ensure that my project is both innovative and grounded in the latest research, enhancing patient care and outcome. All right. So all of these national database may not go for your project, but pick whichever one does. This is just an example. So look at question number 3. Cite specific evidence from your coursework and practice immersion hours in your response. So it is not saying that it's a second question. It's just saying that incorporate examples in the 2 above that we spoke about. But if you like, you could also put specific examples separate from how you've answered point 1 and 2. So here's an example. My practical experience also reflects the application of scientific theory. In my practice immersion hour, I've successfully implemented evidence-based guidelines from nursing database like Medline Plus, Science Direct to enhance patient care. For instance, I've initiated best practice in the management of disease associated with the non-vaccination clients, resulting in improving patient outcome. I've also designed an innovative practice approach such as telehealth program to extend care to underserved population, harnessing the knowledge from the nursing database like Web of Science and all the others that I have just listed just above. So this is just an example of how you could show or cite or give example of how you have incorporated best evidence, best practice, or best nursing science in answering outcome number 1. So I'm going to show you what it should look like on a Word document. All right. And so again, this is a Word, it's an example. So make sure that you use APA whenever you're doing any kind of scholarly assignment, even in your discussion, you want to have your references, citation, it's the same for this assignment. Make sure that you have your APA format for this assignment. And please look at how the title page is set up. So I would advise you to have a little introduction before you go into the outcome. So write an introduction before you go into the outcome. So outcome number 1. Here is outcome number 1. Here's a question that you need to answer. And here are the points. Bullet 1 to answer number 1 question. Bullet 2 to answer number 2 question. And bullet 3 to answer number 3. Here's the thing with number 3. It is not necessarily a question per se. It is just saying in these question above, make sure to cite examples. So you can actually incorporate examples into this. So you may have 2 bullets instead of having 3. All right. So I hope this video was beneficial in explaining what is expected for this assignment. If you have any question, please give me a call, reach out to me. Thank you.